one more question I would have to ask you. So it's two-part question. I'll start with the first part. If you are seeing a patient with stage 4 lung cancer, at which point should they get the molecular testing? And is there a special circumstances that will make you want to start treatment without knowing the molecular testing results? And is it wrong to start treatment without knowing the molecular testing results? So if maybe this time let's do Dr. Marks first, and then I'll do Dr. Yoon afterwards.
Yeah, so I mean, I think if a patient is symptomatic, where uh, there's a large burden of disease, you don't have time to wait. I think you should be still getting that information in the background. I would certainly get a ctDNA immediately to try to inform that decision as quickly as possible. But if a patient is having a lot of symptoms from their actual disease, I would err on the side of giving chemotherapy alone in the metastatic setting, at least for the first line, or at the to buy myself, some time to wait for that test, but also treat the patient while saving that immunotherapy at the risk that if I give them in the wrong order, or if I identify a molecular alteration after I give immunotherapy, they're more likely to have toxicities associated with targeted therapy if I'm switching that quickly. So that's one of the few cases that I'll treat early. But love to hear other people's thoughts as well.
Yeah, I agree with Dr. Marks. I would try to get the molecular testing as soon as possible. So if there's a biopsy, I would send it for tissue molecular testing and would try to get the blood biopsy, liquid biopsy as well. And for a patient who's symptomatic or if their tumors, growing really quickly, but we don't have the molecular testing results, we can always start with chemotherapy. But certainly, with a patient who's, maybe female, never smoker, we really need to be on high alert for those patients who will likely have a molecular alteration. So that's why sending the molecular testing early on so it can get that, process going is going to be very important.